Our healthcare crisis just had jet fuel poured on it as a result of COVID-19 and the economy imploding. So it's been massively exacerbated. Look at this. Because health insurance is tied to employment for about half the country, 160 million people, as many as 43 million are expected to lose their health insurance due to the pandemic, according to a new report by the Robert Wood Johnson Foundation and the Urban Institute. Analysts project that 43 million Americans could lose their insurance when the unemployment rate hits 20%, according to the Department of Labor. The current unemployment rate is 14.7%. Some economists estimate that between 19 and 23.6% of Americans are actually out of a job, including those who lost their jobs in the last 2 weeks and those who have not filed for jobless claims. So, that says it all right there, doesn't it? And I don't think this includes the about 28 million people who didn't have health insurance before the pandemic hit. So add 43 to about 28. That's a lot of people who don't have health insurance. That's a lot of people who are screwed. And this is what the system is like now. Now, compare this to what's going on in the rest of the developed world. In the rest of the developed world, healthcare is a right. Healthcare is, no. What do you mean? That's funded with tax dollars. What, are you crazy? You get sick, you get help. That's the end of it. Like in John Q. Remember the Denzel Washington movie John Q? Where he flips out, he's got his gun at the end. Sick, help! Sick, help! That's what it's like in other developed countries. Here? No. Doesn't work like that here. There's got to be an unnecessary mafia middleman, the health insurance companies. It's got to be tied to your employment, which is a way for your employer to have leverage over you, which, by the way, keeps a lot of people in jobs they don't want to be in. But they have to. I need the health insurance, so they have to be. It's unbelievable. It's like a form of indentured servitude. Our system is totally broken. Totally broken. What we need is Medicare for all, and we need it now. We absolutely need that. We need to copy the rest of the developed world. I don't care. Pick your country. Pick whatever developed country you want. We'd be better off with that healthcare system than we have here with ours. And there's different ways of doing a universal healthcare system. There's public funding of public institutions like the NHS in the UK. There's public funding of private institutions like France. But the connecting tissue is public funding. It's funded with tax dollars. Instead of our money goes all towards war and corporate bailouts, they do healthcare there. That crazy idea. Okay, so here's what corporate Democrats like Joe Kennedy, here's what he's saying as he runs for office in the middle of this pandemic, and these facts are rolling in about millions of people losing their health insurance. Look at this. Not a single patient should be forced to fight off medical bankruptcy in the midst of a global health pandemic without a lawyer by their side. That tweet is too perfect. Somebody frame that and just put it as the perfect encapsulation and representation of the neoliberal corporate period of the Democratic Party. There was the FDR phase, the Social Democratic Party, and then obviously at post-Reagan, you really had the Democratic Party move to the right, welcome the corrupting big money, and then you have the Bill Clinton, Hillary Clinton, Barack Obama, Joe Biden neoliberal period, right? This is the perfect encapsulation of that period. It's like, all right, I'm going to show you guys that we're better than the Republicans and we care. Not a single patient should be forced to fight off medical bankruptcy in the midst of a global health pandemic without a lawyer by their side. Needlessly complex, convoluted, complicated, whittled down. You want to know how that tweet would have been good? Here, ready? Not a single patient should be forced to fight off medical bankruptcy. Stop right there. That's it. Not a single patient should be forced to fight off medical bankruptcy. That's it. That's it. That would be a wonderful tweet. I'd retweet it. See? That's right. Medicare for all. Let's go. Let's do it. Medical bankruptcy shouldn't exist. They don't exist in other countries. They don't exist. But instead, that was only half of it. And then he goes on. So it's not that you shouldn't be forced to fight off medical bankruptcy. No. It's that you shouldn't be forced to fight it off in a pandemic. Oh, okay. So when it's not a pandemic, that's fine. When it's not a pandemic, yeah, go medically bankrupt. I don't care. If it's not a pandemic, yeah, that should exist. That concept should exist. But you shouldn't be forced to fight off medical bankruptcy in a pandemic, because then it'd be wrong if you had to fight it off in a pandemic. And actually, I want you to have to fight it off, but I will have a lawyer by your side. These people stand for nothing. See, this is what happens when you want to be a good person, but you prioritize your donors who are funding your campaign above just being a good person and doing the right thing. That's what this is. This is, oh, let me check where I'm getting my money from. Oh, look at that. I'm getting some money from Big Pharma. I'm getting some money from for-profit health insurance companies. I'm getting money from Wall Street, whoever it might be, whoever these donors are, military-industrial complex. So, I want to be a good person, but it kind of gets in the way because then I won't get the donor money the next time, which means I might not win. So I got to sell out. So, okay, how do I water this down? Not a single patient should be forced to fight off medical bankruptcy in the midst of a global health pandemic without a lawyer by their side. Well, thank you, Joe. What an inspiring message. By the way, JFK, he was in favor of a universal healthcare system, and we covered it on this show. So I think it's safe to say he's rolling over in his grave right now.